Hi, I'm Dr. Edward Fritz. I practice in Mesa, Arizona, originally a native of Cleveland, Ohio. I've been practicing there for 33 years now, primarily with an emphasis on holistic dentistry. Interesting, a friend of mine who was a dentist in Scottsdale had suggested that I come to one of the IA-OMT meetings with him. It was in San Diego that year. And like a lot of people, like a lot of adults still in our country today, I had a whole mouthful of that garbage. And we stopped at a little booth one of the exhibitors had along the way where they had a little machine that measured mercury vapor levels coming out of your fillings. So I did their little test, and then they gave me a piece of gum to chew and told me to come back in about 15 minutes, and they tested me again. And even before I chewed the gum the first time, my readings were off the chart as far as what was allowable government standards for mercury vapor exposure, and after chewing the gum it was, I mean, way off the charts. So I looked at my friend and said, "See, so when we get back, these things are gone. I'm going to come see you right away." So it pretty much personal experience was what started me on the road down there. A little bit of knowledge, and then taking care of myself, getting rid of the toxic material in my own mouth, and so, you know, well, this is what I want to do with everybody else. If I'm going to treat myself this way, this is what I want to do with everybody else. What differentiates us is primarily, I think, the holistic aspect, in that we don't have a cookie-cutter approach to how we do dentistry for people. You know, holistic to me means that we do what's best for each person individually, which means we take the time initially to sit down and talk with them, you know, see what they have to say, what their concerns are, any health issues that they may have. Then we do an examination and make recommendations based upon all that for what we think is going to help them reach the goals that they want to achieve. And we leave it up to them at that point in time, whatever pace they want to go, or, you know, if they want to do all the things we recommend or not. We don't push anything on them. It's basically up to them. You know, how far do they want to go on this journey? We can take them as far as they want to go. Probably the most common thing that I've seen resolve is people who have tinnitus, or ringing in the ears. I've had a number of those people tell me that that has disappeared once they had their amalgams removed. A few who've told me they've had a metallic taste in their mouth for a long time, and that's disappeared also almost immediately. With others, you know, sometimes we get people who are in pretty good health and they're just trying to be proactive about their health, so we don't notice anything major in those people. But, you know, occasionally we have people tell us that it's a gradual improvement if they've been sick for a while. We're always careful never to promise them anything, because you know, that's just one of many things that may be a factor in the problems that they're having. But we have seen some people have improvements in their health over the years. What I like best about my job is really helping people get well, working with people who are genuinely concerned about their health and want to do everything they can to maximize their health. And I like working with those kinds of people. I find that much more rewarding than you know, some of the routine stuff that we do, the occasional person who, well, I just want what the insurance will pay for, that type of attitude. It's much more gratifying for us to work with people who really are interested in maximizing their health and trying to be as healthy as they can be. And it's nice to be able to help them along that journey.